Hello, this is Christopher Jones, and today we'll be performing a ACL reconstruction using tibialis anterior allograft and utilizing the CONMED Infinity ACL reconstruction knee system. Here we are with a right knee cadaveric specimen. We have marked out the inferior pole of the patella as well as the tibial tubercle. Here we will mark the margins of the patellar tendon on both the lateral and medial sides. You can take the knee through a gentle range of motion to get a sense of the joint line and where you want to put your lateral and medial portals. Here we've marked out the lateral portal just off the margin of the lateral tendon to ensure that we are medial enough to look around the lateral femoral condyle. Here we are marking out the anterior medial portal, which we will use as a working portal for addressing any sort of meniscus pathology. We will proceed by using shavers and the CONMED Edge co-blader to clean the intercondylar notch and resect the torn ACL tissue. Here we are identifying both the lateral intercondylar ridge as well as the bifurcate ridge. We'll then use a microfracture awl. We will place a pilot hole in the center of the ACL footprint. We will then move forward with inserting the femoral guide, which is a 7mm offset guide. This offset guide has a 3.5mm spade tip drill. In this situation, we are drilling a 10mm tunnel to preserve a 2mm back wall. We will take care to make sure that we get an idea of when we've penetrated the lateral cortex, and then we will pull back on the spade tip to measure the distance at which we've drilled. That will give us an idea of how long our tunnel is. As the pin exits the leg, we advance it all the way through the far intermedial portal. Using the graft prep board, we have secured the CONMED quick whip to one edge of the tibialis anterior allograft, and we will then secure the second side using the same stitch. This stitch is nice for a quick and efficient way to prepare the graft. We then secure the CONMED Infinity adjustable loop to the graft and center it as the graft is folded over onto itself. The graft is then sized and subsequently tensioned to eliminate any creep within the tendon and ensure that we get good graft tensioning. We mark the distance from the end of the button that matches the length of our femoral tunnel. And lastly, we mark the amount of graft at about 20mm that we want to go into the femoral tunnel for appropriate graft healing and fixation. Using the far anterior medial portal as well as the single fluted sentinel reamer, we can drill the femoral tunnel. Typically, we drill this tunnel to a depth of about 25 to 30mm, making sure that we don't drill too far to blow out the lateral cortex, and we will shuttle a stitch for later graft passage. Here we are viewing the femoral tunnel using a 70-degree scope from the lateral portal, showing a nice 2mm back wall, and then we proceed with tibial tunnel drilling. This is a nice handheld tibial guide with a ratcheting system and quick release. Typically, I will set my guide to about 55 degrees and then advance the tibial bullet up to the proximal tibial cortex and measure my tibial tunnel to an appropriate length. We've marked the center of the tibial footprint. We will then make a separate incision along the intermedial tibia and insert the drill pin into the center position of the ACL footprint. The bead pin is advanced, and then a coring reaver is used to drill the tibial tunnel. A handheld shaver can then be used to chamfer the posterior lateral margin of the tibial tunnel to ensure that it's smooth. Using a 7-degree portal, the tibial tunnel is evaluated. We then move forward with graft passage. Using the retriever, the femoral stitch is retrieved through the tibial tunnel, and the graft is passed into the graft passing stitch. The shuttle suture is then used to pull the graft through the tibial tunnel into the femoral tunnel. Using the CONMED adjustable loop, we pull on the blue and white sutures as the lead sutures to advance the button into the femoral tunnel, and we can observe the button flip on the lateral cortex. Take care not to pull on the white sutures until the button is secure along the lateral cortex. Using the blue and white stitch, the graft is advanced into the femoral tunnel. It is important to apply counter tension on the graft as the graft is advanced. The reverse tab can be used to reverse the position of the graft if you feel like you have overtensioned the graft and need more soft tissue in the tibial tunnel. And here you can see the graft advance back into the femoral tunnel. And here we are cycling the knee to eliminate any more creep within the graft. And with the knee held at an appropriate position, a biocomposite screw is inserted into the tibial tunnel for final graft fixation. Your graft can then be checked for tensioning and to ensure that you like the fixation. And then we proceed with backup fixation along the proximal tibia using a 4.75 CrossFit knotless anchor, given the all soft tissue nature of this graft.